Dr. Preeshagul, when it comes to lung cancer research and emerging treatment options, what specifically are you excited about?
So honestly, I feel that my interest and excitement are getting pulled in a million different directions as of now. Over the past 16 months, we've had 10 approvals in lung cancer, which is unheard of. It's been a very, very, very busy time for us as thoracic oncologists, which is really exciting. I feel that we've really come to the forefront of cancer research, which is outstanding. In terms of what makes me excited right now, I think it's probably two things. There have been genetic alterations, somatic, that have really been almost like the orphan child in lung cancer. And we have, unfortunately had to tell patients, listen, you have this KRAS G12C alteration. We know that it portends a poor prognosis. We know it's more aggressive, but we don't have anything for you that can target that. And as of recently, within the past 2 months, we had this approval for a drug called sotorasib. This is based on the AMG 510 study. And it is a targeted therapy for patients with KRAS G12C, and the responses have been excellent. So finally, we have something. So it makes me feel good that when I have a patient that unfortunately has this alteration, I no longer have to give them the same song and dance, that I can talk about sotorasib and talk about it with confidence and talk to them about the data. Mm-hmm. And the same thing is true for patients with an EGFR exon 20 alteration with amivantamab that just got approved. So it is now, I feel that research is now sort of unveiling these orphan alterations that we are now having targeted therapies for. So that makes me excited. Also, something else that's making me excited is the fact that we're realizing and learning to anticipate these resistance alterations. So we know if you have an EGFR mutation, for say, we know now that unfortunately, at some point, the treatments that we're going to give you, this targeted therapy, this pill called osimertinib in the frontline setting, for some patients, unfortunately, at some point, it's not going to work for you anymore. And this is because the cancer gets smart. It develops these resistance alterations. It knows how to usurp the osimertinib and resist it and make an alternate pathway or change its form, turn into small cell or come up with another alteration that makes the osimertinib not work. So we're realizing to look for these alterations earlier, faster than when a patient starts progressing, and anticipating them. So our trials are now being designed in a way with combination therapy to figure out a way to outsmart this cancer. We always have to be one step ahead. And unfortunately, cancer is still many steps ahead of us, but we are learning to be smarter.